Hello everyone, this is Dr. Carlo Oger, board certified emergency physician with DrER.TV, and if you're watching this video, you are actually on ED Exit Video Pro, my channel that is more specifically targeted at the healthcare enthusiast, whether it be a medical student, student nurse, young doctor, or anybody else who wants to learn about medicine in general. We've been posting some clinical cases. Every Friday, we're going to be posting an EKG interpretation video, so subscribe and stay tuned. This one is about a 39-year-old female, pregnant female, who presented at 24 weeks gestation with a 3-day history of severe and persistent gastric pain, stomach pain. She was referred to the facility for suspected acute gastric ulcer. No abnormalities of the esophagus, stomach, or duodenum were detected by upper endoscopy. That means the patient actually had a camera go down the esophagus into the stomach looking for ulcers and looking for inflammation. While blood was being drawn, the sample was noted to be dark and lipemic, a lot of lipids in it. The blood sample separated into a clot and thick lactescent serum without differential centrifugation. That means it wasn't put on a centrifuge to rotate and separate the blood. It just kind of settled into this. You can see figure A is the blood kind of like being really thick and milky looking. And then after it was sitting there for a while, it turned into this over here, where the blood is just very, very yellow. And that is not how it should look at all. What is the diagnosis? Well, this is hypertriglyceridemia induced pancreatitis. Patient had a pancreatic inflammation, and this was induced by hypertriglyceridemia. The laboratory tests confirm hypertriglyceridemia of 66 millimoles per liter and hypercholesterolemia and hyperamylasemia. That means the amylase levels were real high, that way making the diagnosis of pancreatitis. Amylase is a test that was very sensitive but not so specific for acute pancreatitis. And nowadays, lipase is the test or modality of choice because being both sensitive and more specific for acute pancreatic inflammation. In order to make the diagnosis of acute pancreatitis, the lipase level should be about 3 times the upper range of normal. So in my laboratory test, usually the upper range of normal is like 300. So a 900 makes the diagnosis of acute pancreatitis. Now, that doesn't mean that if it's 600, it's not pancreatitis, it just hasn't met that laboratory number to be diagnostic. Anyway, even though this patient was pregnant, they performed a CT scan of the abdomen, and it revealed fluid over the swollen pancreatic head. A diagnosis of hypertriglyceridemia-induced pancreatitis was made. Although emergency C-section was conducted, a female infant died soon after birth. So that's a very sad story. Baby died. It didn't survive the acute inflammation on the abdomen with the acute pancreatitis. Acute pancreatitis is a well-known complication of hypertriglyceridemia, which might be primary in origin or as a result of pregnancy, as a result of diabetes mellitus, alcohol abuse, or use of drugs. Delayed diagnosis of hypertriglyceridemia-induced pancreatitis can result in maternal death and or fetal mortality, like happened in this sad case. We were later informed by a nurse from the referring hospital that the patient's blood had been remarkably lipemic even 3 days before the current admission. So it kind of was missed, the fact that they could have known that this was true and start treating before it became a more severe problem. The appearance of blood samples from patients should be examined carefully, especially in pregnant women complaining of severe gastric pain. Blood chemistry tests and abdominal imaging should then be performed when hypertriglyceridemia-induced pancreatitis is suspected, so we can treat it early, aggressively, and avoid both maternal and fetal mortality. So, if you ever see a blood sample that looks like this, extremely milky, and then it settles into layers, even without being put on a centrifuge, you have to think about hypertriglyceridemia and hypercholesterolemia, and therefore the complications that can happen from that. So there's your clinical case for the day. I hope you learned something. I certainly learned a lot making the video and reviewing stuff. Make sure you subscribe and comment. What did you learn most about this case? What was most impressive? Have you ever seen blood settle like it did in this case? And hey, I will see you on my next video. Bye-bye.